So this is going to be liposuction of the neck. We start by making a small incision just at the lobule of the ear, just a small little stab incision with the knife. And next we use tumescent fluid, which is a mixture of Novocaine, numbing medicine, and epinephrine. And we go into that area and inject the tumescent fluid, which helps liquefy the fat, but also gives the patient comfort during the procedure. So I begin by just placing the tumescent cannula along the jawline where I want it. And as I push in, you can see the neck filling up with fluid. And we do that nice and even all along the neck, along the neck and along the jawline. It helps separate the tissue planes and makes the liposuction portion easier. So I'll continue to do that, putting more and more fluid in until there's a nice fill of the neck. Again, allows to cut down on bleeding, and also gives patient comfort after surgery. So we're kind of just nice and evenly distributing the fluid throughout the neck. And she doesn't feel any of this. She's asleep, of course. But we can do this awake as well. Just have to do it a little slower with some Xanax. So that's the technique of injecting liposuction tumescent fluid into the neck. And so now the last little bit right in the center of the neck, you can see that now she has nice full thickness of fluid all throughout the neck area. And I'm still kind of evening that out everywhere, so there's a nice amount of fluid all the way throughout. And then that's that. Now you can see the fluids all the way throughout. This is the area I really want to get liposuction on. And we're just going to let that sit for a while and get nice and numb. And give that about 10 minutes or so before we start the liposuction portion. Liposuction cannula, and I use a liposuction cannula just along the deep portion of the neck, and we're kind of a little more aggressive with this part. This is what actually is removing the fat, and so we're just going along the planes of the neck and just starting to remove the fat from the neck now. And so just underneath the skin, you can see the cannula in there, and we're just kind of going back and forth, just performing nice amounts of liposuction. You won't take out a lot of fat with this procedure, but it just creates some scarring underneath the plane and allows the neck to just tighten up. So it's good for patients without too much loose skin. It works really well. And if you look here at the tubing, you can see in my tubing now, it's full of fat. You can see that that's fat from the neck. It's coming out into the tubing and it'll be sucked away. So you can see that nice yellow fat. That's the fat that I'm getting out of the neck. So that is the fat coming out of the neck there, and it'll be sucked away. And I'll just continue to slowly just continue the liposuction of the neck and just remove the areas. Again, this is the area that I'm really going to be concentrating on, but right now I'm just creating some scarring under the skin to allow the neck to tighten up slowly. So it looks tough and kind of brutal, but the patient's asleep, and even an awake patient is so numb right now, they won't be feeling that anyway. So it's just a lot of work from the surgeon, but it works. It's not too uncomfortable, and it's not causing. You can see there's no bleeding, just a nice healthy amount of fat in the liposuction cannula there. So I'm taking that fat out and just working the whole neck, just a little bit at a time, going down and removing that fat component there. This fat can also be re-injected into the face. I can use that fat, purify it, and take the purified fat out and inject that into the face as well. But she won't have enough to really do that. But in some patients, if I'm doing a body liposuction as well, I can purify that fat and inject it back into the face, the cheeks, and use it as a permanent filler. So there we are, just continuing the liposuction, and you can see that nice fat layer, just pure fat going and getting sucked away. And I just continue to do that with this liposuction. This is what the liposuction cannula looks like. It has a few holes on the bottom, and you insert just a small incision right behind the ear, and you can kind of work the whole neck. Really doing a nice job evening it out, having the skin tighten up over time. It takes about 3 months to see the final results as the skin continues to tighten and the neck continues to shrink. But after 3 months, you should see some nice results of your effort. So now we've sucked from both sides, and you can see that the neck is not as thick anymore. This is her main trouble area right here. So we're going to use the cannula again, right in that small little stab incision that I'm going to close later on. And I'm just going to kind of go in there, just right under the surface of the skin again, and suction that neck out. That's going to allow the fat to come out, and also it's going to tighten the skin as well. I'm just sucking right under the neck there in different areas. I've already come from the sides here, and I'm coming down, so I'm fanning in different directions so you don't get any contour abnormalities. You can see here the fat's coming out again. fat is coming out of her neck, and this was her major problem area, so that's what she really needs to have done. And we kind of just go in and just little by little, I take a little bit more out, a little bit more out. And then a little bit on the jowl area, just to get the jowls a little bit there. Again, you can see that it looks uncomfortable and brutal, but it's not. She's totally asleep, and there's not any bleeding. It's nice and controlled. And even if she was awake, this wouldn't be much of a bother. And I just keep working this area and along the neckline to really get that shaped out the way I want it. In patients with excess skin, if there's a lot of skin excess on older patients, what I'll do after this is I'll do a little skin excision and also tighten the neck by putting some sutures into the muscle itself for people who have laxity of the neck muscles. But in her, the muscles are nice and tight. It's just this little excess fat deposit, so I don't need to tighten the muscle in her. You can see the fat coming out. Almost no bleeding. And we just keep working that until until I like the results. Nice and thin, instead of having that thick piece of fat there. Now it's nice and thin, and the skin will start to tighten over the next few months to give her a much nicer shape to her neck. So that's that. I'm going to switch to a different cannula now. This cannula is a flat cannula. It just you can see that this soft one side and the other side has a big hole, and that allows me to scrape along the neck and just really remove all the extra little bit of fat that's along the neck. Is the last thing I do before we finish. So I'm going to put that into position.
Nothing yet.
In this area right along here.
Did you bring anything? I know.
And then I just use that right along the muscles to really just kind of get the last little bit out. Just one last little run all along the neck muscles. Again, to really tighten that neck up. You can see that cannula in there just working along the muscle. And just last little bit here, and then we'll be done. And she's doing great.